Welcome to this eye-opening exploration of health checkups for women over 70. While the medical world promotes routine screenings as a way to catch problems early, recent research reveals that many of these tests might be doing more harm than good. For decades, we've been told that regular health checkups are essential for longevity and quality of life. But what if some of these procedures, widely considered standard, carry serious risks that can lead to memory loss, organ damage, or even life-threatening complications? In this video, we'll uncover the truth behind 5 common health screenings often recommended for women over 70. These tests, though designed for prevention, are increasingly associated with hidden dangers, including unnecessary treatments and emotional trauma. We'll also share real patient stories, backed by the latest scientific studies, to help you make informed choices about your health. Remember, not every test is suitable for everyone, especially as we age. Our goal is to empower you with knowledge so you can ask the right questions and avoid unnecessary risks. So, before you accept any routine procedure, watch this entire video. Your health, peace of mind, and future depend on understanding what's truly necessary and what's best to skip. The overuse of bone density scans. Bone density scans, also called DEXA scans, are often prescribed to detect osteoporosis, a condition that weakens bones and increases fracture risk. While it sounds logical, recent studies suggest that these scans may be overused, especially past age 70. When women reach their 70s, some degree of bone loss is natural and not necessarily dangerous. But the problem arises when these natural changes are mistaken for severe disease, leading to aggressive treatments that carry serious side effects. Many women are prescribed medications like this, but these drugs can cause jaw decay, esophageal ulcers, and even spontaneous fractures. Worse, most women diagnosed with osteopenia, mild bone loss, are not at significant risk of fractures, yet they're often medicated unnecessarily. The measurement system used in these scans compares bones to those of a 30-year-old woman, which can exaggerate age-related changes. Instead of jumping to medication, experts recommend simple strategies like strength training, proper nutrition, and balance exercises. If you have no history of fractures and no signs of fragility, skipping routine bone scans might be the safer choice. Personalized risk assessments, like the fracture risk tool, FRA, can provide a more accurate picture without subjecting you to unnecessary treatments. Blood panels and kidney health. When routine tests can mislead, annual blood panels are a common part of senior healthcare routines, checking everything from cholesterol to liver enzymes. But these tests might not be as reliable as they seem, especially when it comes to kidney function. The standard marker, serum creatinine, can be misleading in women over 70 because it depends heavily on muscle mass. As we age, muscle tissue naturally decreases, which can make kidney function appear better than it truly is. Research shows that relying solely on creatinine can result in missed early-stage kidney disease, delaying crucial treatment. Instead, the protein cystatin C provides a more accurate assessment unaffected by muscle loss. Detecting kidney decline early is vital because medications like NSAIDs and certain blood pressure drugs can be toxic to fragile kidneys, especially when kidney function is already compromised. Misinterpreting lab results can lead to unnecessary prescriptions and anxiety. For example, a woman might be told her kidneys are fine when, in fact, they are deteriorating silently. Regularly asking for cystatin C tests or more advanced kidney function assessments can help prevent this. Focus on symptoms and functional health and avoid over-reliance on labs alone. The risks of CT angiograms in older women. CT angiograms are high-resolution scans used to assess coronary arteries, often recommended for women over 70 with potential heart issues. While they can be life-saving in certain circumstances, their routine use in asymptomatic women is increasingly questioned. The procedure involves contrast dye, which requires kidney filtration. In aging kidneys, this dye can cause contrast-induced nephropathy, leading to sudden kidney damage. More concerning, recent studies link repeated exposure to contrast dyes with a doubling of the risk of vascular dementia. The dye can disrupt blood flow in the brain and promote tiny clots, gradually impairing cognitive function. Many women experience memory lapses or confusion months after multiple scans, often without realizing the connection. Alternative, less invasive options exist, such as treadmill stress tests or coronary calcium scoring, which do not involve contrast dye or radiation. These tests can provide essential information about heart health without risking kidney or brain function. It's crucial to weigh the benefits against the potential long-term risks, especially if you don't have significant symptoms. The controversy around routine pelvic exams. Routine pelvic exams have been a staple of women's health for decades, but recent evidence suggests they may be unnecessary and potentially harmful for women over 70 without symptoms. The U.S. Preventive Services Task Force recommends against screening asymptomatic women for ovarian or cervical cancer with pelvic exams because studies show no survival benefit. Moreover, pelvic exams can cause discomfort, false positives, and unnecessary follow-up procedures like ultrasounds or biopsies. These incidental findings often lead to anxiety and invasive interventions that are not only costly but also risky, especially in older women. Thinning tissues and slower healing increase the chances of infections and complications from unnecessary procedures. Instead, focus on symptom-based care. If you experience pelvic pain, abnormal bleeding, or pressure, then a pelvic exam is appropriate. Otherwise, monitoring and less invasive diagnostics like ultrasound or blood tests, for example, CA-125 can provide safe, more effective care without the added stress or risks. Colonoscopies, weighing the risks and benefits after age 7. Colonoscopies are often hailed as the gold standard for colon cancer screening, but their routine use after age 70 is increasingly questioned. The preparation process involves powerful laxatives that dehydrate and deplete electrolytes, which can be dangerous in older adults. Post-procedure, the disruption of gut bacteria can weaken the immune system and increase infection risk. Research shows that in healthy seniors with prior negative screenings, the benefit of repeat colonoscopies diminishes significantly. The risk of complications like bleeding, perforation, and sepsis increases with age. Anesthesia used during the procedure can also cause short-term cognitive decline, especially in those with pre-existing vulnerabilities. Alternatives like stool-based tests such as FIT or fecal immunochemical tests offer effective screening with far fewer risks. These can be done at home and are recommended annually for those at average risk. It's essential to assess personal risk factors and discuss with your doctor whether routine colonoscopies are still appropriate for your health status. The hidden dangers of routine breast and ovarian cancer screenings. While breast and ovarian cancer screenings are vital tools, their routine use after age 70 warrants careful consideration. Mammograms can detect slow-growing tumors, unlikely to affect quality of life, but they also carry risks of false positives and overdiagnosis, leading to unnecessary biopsies and surgeries. Similarly, ovarian cancer screening with ultrasound and CA-125 blood tests has limited effectiveness in asymptomatic women over 70. These tests often produce incidental findings that lead to invasive procedures with real risks, including infection and surgical complications. The emotional toll, fear, anxiety, and stress be profound. The key is personalized assessment. If you have a strong family history or genetic predispositions, screening might be more justified. Otherwise, focusing on symptom awareness and maintaining overall health can be a better strategy. Regular checkups should prioritize your well-being, not just routine testing that may not benefit you. Reassessing heart screening, stress tests, and calcium scores. Many women over 70 undergo stress tests or receive calcium scores to evaluate heart health. But recent evidence suggests These tests may not always be necessary. Stress tests involve exercising on a treadmill while monitoring heart activity. But if you have no symptoms, the test may not provide additional useful information. Calcium scoring uses a low-dose CT scan to measure calcified plaque in coronary arteries. While helpful in some cases, routine use in asymptomatic women can lead to overdiagnosis, anxiety, and unnecessary treatments. Plus, repeated exposure to radiation and contrast dye raises concerns about long-term safety. Instead, focus on lifestyle factors. Maintaining a healthy diet, staying active, controlling blood pressure, and managing stress. If you have unexplained symptoms, discuss with your doctor whether these tests are appropriate. Personalized risk assessment is the key to avoiding unnecessary procedures and focusing on what truly matters: your health and quality of life. The overuse of ovarian and pelvic screenings. In women over 70, routine ovarian and pelvic screenings often continue despite limited evidence of benefit. Tests like pelvic ultrasounds and CA-125 blood tests are frequently performed during checkups, but they often lead to false alarms. Incidental findings can initiate a cascade of invasive procedures, biopsies, and surgeries that carry significant risks, especially for older women. Many benign cysts and growths are discovered that never cause symptoms or threaten health. The anxiety and physical toll from unnecessary interventions can outweigh any potential benefits. The guidelines now recommend a symptom-driven approach. If you feel well and have no pelvic complaints, routine screening isn't necessary. Instead, focus on maintaining overall health, monitoring for symptoms, and having honest discussions with your doctor about which tests are truly needed. This approach minimizes harm and ensures your healthcare is tailored to your individual needs. Rethinking cognitive and memory tests. Memory and cognitive assessments are common for seniors, but some tests may inadvertently contribute to decline. For example, repeated neuropsychological testing or scans like Mr. IS and CTS, especially when done unnecessarily, can cause stress and anxiety. In some cases, overtesting may lead to false positive findings, prompting unnecessary treatments or medications. Recent research indicates that unnecessary medical interventions and the stress of frequent testing can impact mental health, leading to a cycle of worry and overtreatment. Instead, focusing on lifestyle factors such as mental stimulation, social engagement, physical activity, and proper nutrition has been shown to support brain health. If you notice mild forgetfulness, talk openly with your healthcare provider about whether testing is necessary. Often, maintaining a healthy lifestyle and monitoring symptoms is more beneficial than routine, invasive assessments that might do more harm than good. The importance of symptom-guided care. One of the most critical lessons for women over 70 is to shift from routine, one-size-fits-all testing to symptom-guided care. Not every test is necessary for everyone, and many procedures are best reserved for when there are clear signs of a problem. This personalized approach reduces unnecessary risks, stress, and medical costs. Listening to your body, sharing symptoms honestly, and trusting your instincts are vital. For example, if you have pain, bleeding, or new symptoms, then targeted testing makes sense. But if you feel well and have no concerns, unnecessary screening might do more harm than good. By advocating for personalized, symptom-based care, you can protect your health while minimizing exposure to risky procedures. Always ask your healthcare provider why each test is recommended and whether it's truly necessary, given your health status and age. Final thoughts: making informed choices for your health. As we conclude, remember that the most powerful medicine is personalized care, rooted in your individual health, history, and needs. Routine tests can be valuable, but they're not infallible, and blindly following recommendations can sometimes lead to harm. The key is informed decision-making, asking questions, understanding risks, and balancing benefits against potential dangers. Your health journey is unique, and the right choices depend on your circumstances. Focus on lifestyle, preventive measures that are proven effective, and open communication with your healthcare team. Never hesitate to seek second opinions or to question the necessity of tests and procedures. Empower yourself with knowledge and advocate for care that's truly in your best interest. Thank you for watching and caring about your health. Stay informed, stay safe, and remember, your well-being is worth every question you ask.